I know I said I'd be gone and do replays for the next 2 weeks, but the news had other things in mind. So I'm back here just one last time before I take a week off with my family because I wanted to talk about what occurred in the news last week, and that is the passing of the NDAA through Congress. Now, if you don't know what the NDAA is, it's the National Defense Authorization Act. It's HR 5009 if you want to look it up. It passed through the House and then it passed through the Senate. But here's the thing is you might be thinking, well, what does that have to do with gender affirming care? And that would be a great question because what it is the funding, the budget for military spending. It is the budget for our defense. And so what it has to do with gender affirming care began in the House of Representatives when Representative Mike Johnson put in an amendment into that bill that talked about preventing TRICARE, which is the active military families, members and families healthcare insurance, that putting in there that it cannot cover gender affirming care that could create sterilization. And I'll give you the exact quote in just a bit. But that was placed in there in this, what I consider a very important legislation because it is the funding for our military. And so it passed the House, it got moved to the Senate. Now, in the Senate, Senator Tammy Baldwin from Wisconsin did try to create an amendment to take that part out. She did have some support, but at the end of the day, was asked to put it down because the concern of stopping the passing of this bill. So it passed through the Senate, and it is now on the desk of President Biden to either sign in or veto. So that's where it is as I'm recording this right now on December 20th. So, from a medical perspective, there are a couple concerns I just want to bring to our attention as we look at this. The first one is there are no other regulations on TRICARE healthcare that are legislated from the Congress. Meaning what TRICARE covers and doesn't cover is typically decided by the Defense Health Agency. The DHA makes those decisions. And correct me if I'm wrong, because I spent a lot of time looking and researching to see if the Congress has ever put in any legislation that says you can't cover this. All I could find is what the Congress has done. The different legislation that Congress has included in the NDAA has to do with eligibility for coverage, like not what is covered, but who is covered. So it concerns me that this was placed in there to regulate a form of healthcare, what is done, what healthcare is provided, that I do not see has ever been done before in this way. Like I said before, it's typically decided by the Defense Health Agency. My other concern is the language. So let me read to you exactly what was added on to Section 1079A of Title 10 of the United States Code. They added in, quote, 20, medical interventions for the treatment of gender dysphoria that could result in sterilization may not be provided to a child under the age of 18, quote. The term could create sterilization. When we look at what might create sterilization or infertility, for that matter, yes, those two words mean two slightly different things. But not being able to procreate. If we take a medication, I'm not talking about gender affirming care. We take any medication and we study it and we do the research and we demonstrate that it does not have an effect on fertility. Can we say that it couldn't cause it? I think when you add the word could, anything could cause it, right? When you consider that 30% of fertility is idiopathic, meaning we don't know. It's a fancy word to say we don't know what caused it. We looked at all the things we can look at and we don't see a reason. So if you consider some papers quote 15, but most papers quote about 30%, of unexplained or idiopathic infertility, that's what makes it really hard to say with complete 100% confidence that something couldn't cause that. It's unlikely that walking down the street could cause it, but possibly, like, who knows what we'll learn in 50 years of what was in the environment, what was in the air. Could it cause it? Maybe, but probably not. So that's one of the issues. It's really hard to provide any sort of medication for gender dysphoria with that kind of language. The other concern I have it from a medical perspective is I look at, like, why is this being treated differently, right? It's being treated differently from a legislative that it's being decided what is covered and not under health insurance, and even putting such a weight on sterilization when there are other treatments in healthcare that cause sterilization in children under 18. And they know that because that's why they specify specifically for gender affirming care, because they know there are other medical treatments. And what happens in those? So if you're like wondering, like, what? Well, cancer treatments, radiation, some chemotherapies can cause it. And so, what do we do in those scenarios? Most people have no problem saying, oh, no, 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 that's okay, because, the child could die. But the child could die without gender affirming care as well. And I know many of you think that's not the same, it's different. And I think we'll have to agree to disagree on that one. But here's the thing, let's talk about that aside. Let's talk about what is done in those scenarios. What is done is consulting the family, consulting, explaining, here's the chances, right? Because nothing in biology is 100%. They're not always or nevers. That's why when you say the word could, anything could. So that's the issue when there are no always and never. So you might say this most likely will create this issue. Can't tell you 100% certainty, but most likely this will lead to sterilization. So we educate, we talk about the options. We talk about the options that are being studied and done now. This is actually experimental. There is some experimental studies being done that can freeze eggs and sperm prior to puberty, prior to development. We already have the technology to freeze post maturity, but they are now working. This is experimental on being able to do that prior to development. So you have these kind of discussions of what's available, what's not available, what's being worked on, but not yet, and we don't know if it'll work out. You have these discussions, and you, as a family with your provider, decide what to do. And so it didn't surprise me to see some quotes from members of the military and their families saying, you trust us with the safety of this country, but you do not trust us to make decisions for our children. Again, this is something that I am not aware that we've seen before. Legislating through federal law what can and can't be covered by TRICARE insurance. So if this bill passes as is with that amendment in place, it'll be the first anti-LGBTQ plus legislation that has been passed since the 1990s. So for those of you that are healthcare providers, for those of you that have loved ones that are part of the LGBTQ plus community, things like this make them scared. That after about 30 years, the tide is changing. And yes, this is anti-trans legislation because it goes against medical opinion. Now, I know some of you will talk about the CAS review and talk about the countries that have put limitations. The UK, yes, has banned gender affirming care, but some of the other countries that have put regulations, not banned it, have put regulations on gender affirming care, but what's failed to be mentioned are all the countries and organizations that do support gender affirming care, like Canada, like Australia and New Zealand, like the Endocrine Society, the American College of OBGYN, that's mine, American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, the American Psychological Association, the World Professional Association of Transgender Health, WPATH, an international organization. All of those that do, and most remarkably to me, that just came out in mid-November is France. France come out with a very strong consensus supporting gender-affirming care, and what was so impressive to me about that consensus was the level of scrutiny that they came to that decision. They spell out who was part of that committee, how they came to every conclusion. In fact, it was so fascinating to me that I thought, I wonder how the CAS review did it. Because it was clearly spelled out in the French consensus paper, which reads like a beautiful scientific paper, because it is. And I'll be honest with you, I haven't read the actual CAS review itself. I have read bits and pieces and articles, but when I went to it to look to see the way a research paper is written, even a review, to see, just like the consensus, if it spelled out who was doing it, how they did it, it did not. It is not clearly written in there. I looked at it for a long time trying to find, and I began to see, looking at the actual CAS review, some of the other differences. Like, yes, there are a list of resources of all the papers they reviewed. They don't cite them in their opinions. So when they make a recommendation, typically you would cite, this comes from reading this paper, the way they did in the French consensus. It's not there in the CAS review. So why am I saying all this? I think what we listen to matters. I think that we need to pay attention when we start doing things differently, when we add an amendment into a different bill that is so important. We have to stop and question, even if you agree. Obviously, I do not, but even if you agree with that amendment that was added, we have to stop when something's being done for the first time and think, is this really what we want? Do we want, when it hasn't been regulated before, that politicians decide what should and shouldn't be covered in health insurance and take it away from the way it usually is done? Because even if you agree with this amendment, what happens next time when it's something you don't agree with? When it's something that affects the healthcare of you or someone you care about? Are you going to be glad that we started doing things this way? I always think about that. Even if it were something I agreed with, I think about, do I want things done this way? I give that to you consider. And I give it to you that I'm concerned for all the reasons I've mentioned, because I do believe gender affirming care is standard of care. It is health care for patients who are transgender at all ages. So before I go, I want to offer you one challenge. You can take it or leave it. And I'm including myself in this challenge. I want you to read one thing about transgender people, about transgender families, that is not in your echo chamber, that is not something that you at face value would agree with or believe in. I encourage you to read it. If you want some suggestions, just message me and I will give you, let me know if you prefer books or videos or whatever. What I will do, as I mentioned, I have not read the actual CAS review. What I will do is read the actual CAS review. That will be my part, my challenge to myself. And I invite you to join me to read something that goes against what you believe about gender. Because I think it's important that we open ourselves up to hear things, to hear different things. It doesn't mean that we have to agree. To be open and listening does not mean we have to agree, but it means that we were willing to consider. We're willing to take it in. We're willing to learn new things without the visor of like, no, this is totally ridiculous and wrong. It's like, okay, let me be curious for a second. I don't have to change my mind. Let me be curious for a second. Let me see, let me read something that's a little different and just be open to it. and go from there. So let me know if you take the challenge on. I'll be interested to hear. And you'll hear at some point in the next month or so, because I have a lot of podcasts planned, but I will at some point do a podcast on the cast review because I will have read it as I promised. But as I mentioned, I came back when I said I was going to be on vacation because I want you to be aware of what's going on, no matter where you stand on the issue. I want you to be aware when something new is changing, when something new is happening, when there's a new strategy taking place, because awareness matters. Have a happy new year.